to A Road Less Traveled podcast. I am your host, Hilary Haron, and today we have with us Dr. LeighAnn O'Banion. Thank you for joining us.
Thank you for having me.
If you can please give us a little bit of your background and education and current position.
Great. So I'm LeighAnn O'Banion. I am a vascular surgeon at UCSF in Fresno. I work for CCFMG, and currently I've been in practice for about 6 years. I did my medical school at LSU in New Orleans, and then did general surgery at UCSF Fresno, graduated in 2015, went to main campus UCSF in San Francisco for my vascular fellowship, where I graduated in 2017. And then when I was a resident, I met my husband, who is born and raised in Fresno. And so we got married, and then I did my fellowship and then came back here and have been practicing ever since.
Amazing. And you have two little beautiful daughters?
I have two beautiful daughters, Ellie, who's 7, and Maddie, who's 4. And they keep me just as busy as my job does.
That is amazing. You're setting an incredible example for your girls. I was talking to somebody the other day who said, I was talking to my daughter about doing this podcast, and I said, I'm a woman in a male-dominated industry. And she said, my daughter didn't even know. And I was thinking of you and your girls, and do they have any concept of what you do?
Oh, we talk about it all the time because, as a female surgeon, it's different than being a stay-at-home mom. I'm gone a lot. I have a full-time nanny who takes care of my kids from 7 in the morning till 5 at night. 5 days a week. And so it is different. And so, but I want them to grow up knowing that mommy works hard and mommy works hard so that they can have a great life. But also that mom's an empowered female who saves people's lives. And we talk about it. And, Monday I was on call and I got called in at like 6:30 at night. And I looked at it, Maddie's 4, so she's not quite at the understanding age. She knows mom's a doctor.
Yeah.
But Ellie's at that age where she's really starting to understand. If Grey's Anatomy's on at night, she's glued to it. And she's like, do you do that? And so I told her, I said, baby, I got to go into the hospital. And she's like, why? And I was like, well, someone's dying and they're bleeding to death and I got to go fix them. She's like, okay, make sure you do a good job. And she's like, I'll be okay with Dad. He's going to tuck me in.
He'll be all right.
It's going to be fine.
I'll take care of him. Don't worry, Mom.
And then in the morning she asks me, she's like, how did the patient do? Are they okay? And so she's starting to understand and hopefully respect it. And, whether or not she wants to go into medicine is totally up to her. But just know that like mom works hard, just like daddy does.
Yeah.
And so I think that's important.
I 100% agree. So you have your own practice and you work, do you work for the hospital also? So on call, is it your patient or is it a patient? Like, does something happen and then you're called in?
So we have kind of a unique setup where I work for a multi-specialty group, currently at Central California Faculty Medical Group, or CCFMG. So we don't actually work for the hospital, but we are the only vascular group in the Central Valley serving, all of Fresno and Clovis and the surrounding smaller communities. And so we all are core faculty for UCSF Fresno. So we have a teaching position where we teach all of the residents and the medical students that are here in the Central Valley. And so when we take call for the community hospital system. And so anybody that comes through the emergency room, anyone that, we get a call that there's someone who's bleeding or has a limb-threatening problem in Reedley, we'll get the call, we'll transfer them in because Reedley and Parlier and Porterville, none of them have that specialty care. And so we really do serve all of the Central Valley, which I think is great. I'm from a small town in Louisiana, and so coming to Fresno, I kind of get that same small town feel, and I love serving my community, and I love this community. So I love my job.
Are you, I'm not sure if you even have time for that, but are you involved in like other community things? Other than community events, but like, are there any groups that you're a part of, or even professionally, are you a part of any groups, specifically women-related groups?
So a couple of years ago, Teresa Daniele and I, and she's the chief of cardiology at UCSF Fresno, we developed this group called UCSF Champions, which is a group dedicated to providing outreach efforts into the community to screen patients for cardiovascular disease. Because a lot of the community doesn't know what they're supposed to look for that diabetes is bad and diabetes is related to obesity, and that you need to look at your feet and look and see if you need your toenails trimmed. Basic healthcare things. Check your blood pressure. Do you have high blood pressure? And so there's really poor health literacy across the San Joaquin Central Valley. And so this was kind of a mission to go out into the community to provide that health education. So we've actually been doing that, and we've kind of finally got to a point where we're starting to ramp up with these events. So we've gone down to Poplar to a food bank and screen patients. We have been to the Mexican consulate a couple of times. We're going to go to the Hmong New Year celebration in Madeira in a couple of weeks and provide screening for them. So that's been a really fun thing, and it's been great to do it with, another empowered female. And so I'm very proud of what we've been able to accomplish, and we've got a couple of great medical students through the SJV Prime program through UCSF who have been running it. And so, and both of them are female, and so it's been really great.
That's amazing.
It's been awesome.
That actually leads me kind of into the next topic, really, which is mentorship. Did you wake up one day and be like, I want to be a vascular surgeon? Or how did you get there?
I actually woke up one day and thought I wanted to be a plastic surgeon.
Okay.
And then I went to general surgery residency, and what I realized about what I loved about surgery was sewing the tiny little blood vessels, which is part of plastics, but it's not everything. And so then I did my vascular rotation. I was like, man, I could do this. This would be really great. And I had a lot of great mentors. One of them who is still my partner today, and he's amazing. And then when I got to my fellowship, that was really where I think the long-lasting mentorship became. Two of the faculty at UCSF were female, and they were just unbelievable. They were amazing mentors. I was the first female vascular fellow at UCSF to ever get pregnant.
That's
and
go.
So,
Good for you. You're doing both things.
And so I was kind of an anomaly. They were like, what do we do with her? You're in this really challenging fellowship where you don't, you're constantly go. Sometimes you don't sleep very much. And now you've got a pregnant person. What do we do about fluoroscopy? What do we do about radiation safety? How do we handle breastfeeding and pumping in the middle of everything? And they really just dove right into it.
That's great.
I had a good maternity leave. I was respected all throughout my pregnancy. I had a great, experience afterwards. And so, I think California really does it right. And the UC system is really committed to uplifting women and supporting childbearing and pregnancy and wellness for women in the surgical field and in medicine, which is great. I mean, the rest of the United States should really model off of that because they've really figured it out and done it well.
I keep hearing, just in my general conversations with women who are leveling up in their careers, they're right at that pivotal point where either I want to have babies or I want to get married, and they're like, well, I have to choose because I have to keep showing up. And I think that the demonstration, that you have provided for everybody is that you can actually do whatever it is that you want to do.
Yeah.
What was pivotal in getting you through those moments where you were like, I literally, cannot stand on my feet today?
I mean, I think you just have to look ahead and you have to look at who's coming behind you. Historically, everyone has been told you have to choose, that you can't do everything. And I think that mindset is changing to telling women you can do whatever you want. One of my very good friends is a surgeon, mom of 3, and her husband is a stay-at-home dad. It's okay to reverse the roles and be a strong, powerful female and have the dad be the one that stays at home and takes care of the kids. There is no, gender identity of what you're supposed to do based on your sex or your gender. You can do whatever you want to do. And I think over the last couple of decades, we've really started to empower females. And, if I do it, then the next generation of women that sees that as an example is going to feel empowered to, continue on in that same path.
Are you, on that same kind of note, are you seeing more women entering the medical field in your arena? Or, so one of the things that I want to talk about is male domination defined by your industry. So is it that the industry is male dominated by volume, like by the amount of men that are in it, or is it just that the decision makers or the people that get into those higher positions are typically men. Which or both are the case for you?
I think it's a little bit of both in vascular surgery. I mean, historically, it's been all men. We're about, depending on the literature that you want to quote, we're about 11 to 15% board certified vascular surgeons are female.
Okay.
So it's not a lot. There's not a lot of us, but we are mighty. And we have formed, a solid group that we stick together. We discuss things that are important and how to, but when you think about it, you can't just go say, okay, well, half of the leadership positions should be women,
Right.
because we don't compromise half of the society. But you do need to have that female presence. And I think we're getting better at having our voices heard. We just have to be a little bit louder and work a little bit harder. And that hasn't changed. I think the difficulty and the challenges that women face are still there. And you have to be that much better, work that much harder, be that much louder to not only get into that position of power, but once you're in it, be heard and respected. And that stereotype hasn't changed as much as I think we'd like to see, but we just have to keep pushing.
Feels like sometimes when there is an amplified voice, it comes with, you're not fulfilling the role as a quiet woman. And I don't necessarily personally feel that way. And so I'm kind of curious, how do you amplify the voices of those around you and those, coming into medicine or vascular surgery in particular?
I mean, I think you have to be an upstander, not a bystander. And so, when you see, because not everybody is going to be loud. Not everybody is going to be willing to just say what's on their mind. But if you're one of those people, you have to use it to your advantage and everyone else's, advantage as the opportunity presents itself. So, if you see another female not being treated right, you need to speak up. If you see someone being mistreated in the workplace, be the one to speak up. Don't just stand there and say, well, that's the way it happens. Be an advocate for other women. Be the one that puts the crown on the other woman's head and be proud of her. And so, we need to not only do things for ourselves, but, all work together to uplift women as a whole.
And you are incredibly talented, and the way that you speak is very, what's the right word? What's the word I'm looking for? It's engaging. Have you found that you have been able to change the narrative for some men who were maybe, I don't want to say naysayers, but naysayers for lack of a better term initially?
I mean, I like to think that we try. It's really hard to change someone's point of view. It's really hard to change the way people think. But I think it's not so much in what you say, but your actions, especially in the surgical field. If you can walk the walk with talking the talk, I think sometimes your actions speak louder than your words. The quintessential saying is really true. And so if you are pushing the limits, if you're doing the groundbreaking research, if you're having great patient outcomes, if your patients are happy and you're a good surgeon, that goes a long way. Because if you're just someone up there who's talking, it doesn't, I don't think men really respect that. They just think, oh, that's some woman, she's just, running her mouth. But if you actually get up there and you've got the work to back it up, and that's what we have to keep doing is not being afraid. We've always been told to be the quiet one, to be, just put your head down and do the work. And you need to be proud of what you're doing, and men aren't shy. They'll get up there and say what a great job they did, or they're not afraid if they win an award to let everybody know. And we need to be a better job of being advocates for ourselves when we're doing really good work.
Especially showcasing, because it's a little more difficult for women, maybe showcasing other people's work, at least that puts it out there in some sort of way. But I completely agree. It's a real struggle to be like, I did that. And my dad calls it waving your own flag. And he's like, you need to go get some flags. And I'm like, well, I don't want to get the flags. But you're completely right. We're really, really bad at it. What do you do when you're tired? What do you do when you're like, I don't want to wave my flag. I don't want to get up today. I need to recharge my batteries.
I think you just have to dig a little deep and remind yourself of why you're doing this. we don't go into medicine for the money or the notoriety. We go into it because we want to help people and we want to help patients. And so you think about that one patient who is so grateful, and that one patient whose life you saved, who is able to play ball with their grandkids now, that couldn't before. And that kind of is what gets you out of bed and lets you keep going when you're really tired. And then also thinking about my daughters and that I'm doing this for them, and I've got to be a good role model. If I come home and I'm grumpy and I'm tired, that doesn't set a good example for them. And so, I think you just have to keep those positive thoughts in your head, even when it's really tough, and just keep trucking along.
How was it going through school in the South? Was the men to women ratio equal? I mean, the media really plays out the North-South thing, right? So I'm kind of curious how your experience was.
It's funny how you forget things.
Yeah.
But
I call it momnesia.
But I mean, I was in, medical school was a great experience. It was definitely more male dominated in the South than it is. California does a really good job. My practice at our vascular practice is 50% women.
That's incredible. I would have not known. Thank you for saying that.
And
that's wow.
At UCSF Fresno, the surgery department is nearly 50% female.
Wow.
So, the chair of surgery at UCSF main campus is a female. And so, California, I think, really has embraced that, and we do a much better job as a state than some places in the South. So they've got some catching up to do, certainly. But I had a great experience in med school, and certainly encountered, more so in the stereotypes, not necessarily while you're going through school, but in the patients. Like, oh, darling, you must be the nurse, or you must be the can you go get me some ice water?
Yeah.
Or, no, I'm actually the doctor, the medical student, And so the patient's perception is different when you're in the South, I think.
How did you overcome that? I mean, other than punching somebody in the nose and being like, I'm the doctor.
I think you just have to be strong. You can't just kind of hide behind and walk away. You need to walk up and say, no, I'm your doctor. I mean, it still happens on occasion where the male intern, my patient will be like, no, my doctor just left. And I'm like, well, I'm actually your surgeon. That's my trainee, my intern. And they're like, oh, really? And so you just have to be strong and remind them that you are their doctor and you are the person in the position of power and there to help them. And when you're upfront about that and very strong about who you are, they respect that, and most of the time they're like, oh, I'm so sorry. I didn't mean to call you the nurse. Not that there's anything wrong with being a nurse, but it's not who I am, and it's a stereotype.
Yeah.
And so I think you just have to call them out on it in a very kind way and just remind them, like, no, that's not me.
I think that's very, very good advice. How do your trainees, what's the technical word for that?
Trainees, I mean, I think that's all encompassing for residents, fellows, medical students, future doctors of America.
Do you notice that in those situations, in those, leadership positions, or even with, as mentees, that they are less apt to give any attention to gender or to the stereotypes or any of that?
I think at UCSF Fresno, like the up and coming generation, they've got it down. Like they didn't have to start from where we started. And so they've got a great path ahead of them. They just have to keep pushing along, but they really are mindful about it. And it's constantly something that they're aware of. Be mindful of what your gender is. Yeah. Be mindful of, who you are as a person, and not just do that blanket stereotype that, historically we've been guilty of.
And do you draw power from that, like standing in your integrity, standing in your power, knowing who you are? Did that take you time to figure out, or did you always kind of know, like, this is who I am, these are the things, and...
Oh, imposter syndrome is real. It is so real. I mean, there are times where I'm like, oh, I don't want to go do that. Like, I don't want to, no, I can't do that. Or someone will ask me to do something. I'm like, why are you asking me? Like, I don't deserve that. And I think as you get more comfortable in your own skin, that gets easier over time. But you still constantly, there's still times that I get asked to do something. I'm like, you sure you want me? Like, I don't know. Like, there's got to be someone else out there. And then, and then surrounding yourself with empowered female colleagues, because then you'll have, I'll have a friend of mine who will just smack me in the head and she'll be like, LeighAnn, of course you deserve to be there. You're amazing. You should go do that. And then it helps to have that core group of amazing females to be surrounded by, to constantly remind you that you can do this.
How do you find those women in your, are they all in your industry, or do you have kind of an advisory council?
I would say that there's a group of probably like 10 of us that are all vascular surgeons, and they're my people.
That's crazy, first of all. I'm like, 10 vascular surgeons? Oh my God.
They are my people. Like, they're my people that I group text. If I called any one of them right now, they would pick up the phone and be like, what do you need? And we all listen to each other. We cry on each other's shoulders. We all go through the same things. A lot of us are moms. Some of us have been divorced. So, we've all experienced the hardships of going through medicine and raising a family and getting through this life. And doing it together. And I think it really makes a huge difference to be able to uplift each other and just lean on each other's shoulders when things get hard.
1,000%. Do you have, this is kind of a left turn, do you have what you feel like is balance, or is that a term, it's not a term that I care for. So I'm curious, what do you call that transition between your personal life and your professional life?
I have no balance. I run at like 150%, 7 days a week. It is something that I will always struggle with. I'm getting better as I get a little bit older at trying to turn things off. But if work calls and it's a Sunday morning, I will answer. If my kid's school calls in the middle of an operation when the aorta is cross-clamped, I will answer. And you never turn it off. And I don't think it's work-life balance, it's work-life integration, and figuring out how to make everything work together so that everything works well.
I love that you're redefining that concept, because I agree with you. I don't think it's a balance. I think it is exactly what you said. It's an integration. And I think that your daughters are very lucky to have you as an example. I think we get really lost in that sometimes, right? Like you said, imposter syndrome is completely real. What advice would you give little LeighAnn?
Little LeighAnn, oh my God, conquer the world, keep going. Like, don't ever let anybody tell you you can't do anything. And that's what I tell, every young female resident, every trainee, every junior faculty who needs advice. Just do it. Just keep pushing. And if someone tells you no, go find someone else who will tell you yes. Don't ever accept no. Go after your dreams, and just keep pushing the needle and moving it forward.
What about advice? Would it be the same advice? I guess would it be the same advice for people, or women specifically, thinking about getting into the medical field? Would you say figure out what you really like first, or just jump in and figure it out?
I mean, I don't think that you're going to know what you like until you get in there. And if you want to help patients and that's the path you want to go down, get in there. Try out everything. Because I thought I wanted to do something completely different. I thought I wanted to be an oncologist when I was in college, and then I got into med school and wanted to be a plastic surgeon. And then I tried everything out and then really figured out my passion. You don't have to figure it out on day one. Just dive right in, and you might figure it out and think you figured it out, and you get into a year of practice and you're like, I don't like this, I want to do something else. That's okay too. You can constantly change your path of life, and no one can tell you what you can do. Only you have to find your happiness, and you're going to be best at what you do if you're happy. And so you have to find your passion in life, your happiness in life, because that's when you're going to be the best doctor, the best mom, the best spouse, and the best version of yourself.
Aligning your passion and your purpose.
Yeah.
Can you give an example of a time that you kind of lost your passion, or you felt like somebody took it from you? Like maybe a time that you encountered adversity and you had to really step back and figure out a new coping mechanism or some way to overcome it. Maybe it's a defining moment.
Yeah, I mean, early on in my career, I definitely encountered some adversity in terms of like, that male-dominated field and that power struggle of men maybe feeling whether it's intimidated or threatened or, and so there can be that struggle, and oftentimes it can lead to conflict, and then you're not happy. And so you're thinking every day, is this something I'm doing? And, how do I resolve this? And that can be really, it can be a defining moment. And you're like, can I do this? Do I want to do this? And I think one of the things that sits and kind of resonates with me that, I tell everyone that's willing to listen is you're not responsible for the emotions of other people. You can only control yourself, how you present yourself. And, not everybody's going to like you. Not everybody is going to think that women should be surgeons. Not everybody's going to think women should be in a position of power. But that's not your responsibility. You have to be the best version of yourself and just keep doing you. My partner tells me that all the time. She's like, you know what? You do you. I even had a little pin that I got because I think that was kind of like how I overcame that. And and to this day, there'll be times where somebody will say something to me and I'm like, I don't like that. But it's like, you know what, that's on them. And so I just keep doing the best and being the best person I can be and, practicing with integrity and holding your head up high. And I think that helps you and gives you the drive to keep pushing forward. And it's amazing how if you just kind of work with that, everything kind of falls into place. And then the naysayers and the people that are trying to bring you down kind of just flit away.
They don't sense any weakness, so they're not going to bring their bullshit, for lack of a better term.
Yeah, there's no blood in the water.
Stay away. Are you planning on? Where is there up from being a surgeon?
There's no up. No, for me, yeah. There's no, I don't want to be the CEO of the hospital. I am so happy just taking care of my patients and being a good mom. And that's enough. Being a good surgeon, scientist, and being there for my family, to me, it doesn't get better than that. I'm so happy with where I am in my career. And I just want to continue to be the best doctor I can for my patients.
That's the best doctor you can have. And what you do is incredible. I think that you mentioned earlier, there's a lack of literacy around even the little things like trimming your toenails. What is advice that you would like a top 5 things that you think people should know, but they don't know?
I think that people just, it's basic healthcare. It starts, you shouldn't worry about whether or not you have an aortic aneurysm. You should worry about the foundation of health. So is your blood pressure controlled? Are you at a good weight? Is your cholesterol good? These are basic labs that you can get from a primary care doctor. You don't need a vascular surgeon right away. Go to your primary care doctor. If you are a grown adult, you should be seeing a primary care doctor once a year. And if everyone would just do that, there would be so much more preventative care that I think a lot of this would be mitigated. I think there would be less vascular disease. If the patient does develop it, it would be caught earlier because patients are being taken care of. Most of the time when we see advanced disease, it's patients who are not being taken care of. They're sitting at home, they're not paying attention to their health, they're not taking care of themselves. And then the most important thing for vascular is walk. Get out there and walk. Walk 30 minutes a day, take a walk. It doesn't have to be a power walk. It's amazing what walking does for the mind, the body, the heart as a whole. So take care of yourself, see your primary care doctor, and get walking.
I am going to take that advice to heart. So you're going to see me walking around.
You'll see my husband walking around.
It's one of the hardest things for me to do because I get so far into my head. So unless I have some sort of soul-shaking volume music, I'm doing what we do in our heads. But thank you a million times for being here, sharing your time with me. I'm so grateful for that. What you do every day is a blessing to your patients, to our community, and I'm so grateful to have you here. I'm really happy that you guys live here. We're lucky to have you in the Central Valley.
Well, thank you for having me and allowing me to share my voice with your audience. I appreciate it.
Thank you.